Hi, welcome to another episode of the Embracing Joy podcast. I'm so excited to introduce our current repeat guest, Dr. Noemi Adame. Thank you for joining us today.
Oh, I'm super excited to be here again. Always good to talk to you.
Yeah, awesome. So, Dr. Adame, also known as the Veggie Over Pills Doctor, is a board certified pediatrician. She's a plant based home cook, she's a writer, and she's a physician wellness advocate. She's the owner of Culver Pediatric Center, which is an award winning direct primary care clinic focused on healing children with complex medical conditions, including PANDAS. She has additional training in lifestyle medicine and integrative care of neurodivergent children. And she also writes a regular wellness column in the Culver Citizen. It's such a pleasure to have you.
Yeah, good to be here.
So let's start with our warm up game.
Oh, that's right. I remember it. Yes.
Yeah. So it's called Convergence, and we'll say the first word that's on our mind on the count of three.
Okay.
Three, one, two, three.
Snow.
Spice. This is spice.
Okay.
Okay, so something that connects spice and snow
Ah,
on the count of three. One, two, three.
Cocoa.
Latte. Ah, they're singing latte.
Yay!
So
Cocoa and
we're thinking,
latte. Okay.
yeah, we're thinking about drinks.
Mhm.
Oh, well, on the count of three, a word that connects the two. One, two, three.
Mocha.
Warm.
Oh,
Okay.
warm. Yeah.
Yeah, warm and mocha. Something that connects those two.
Mhm.
One, two, three.
Fire.
Comfort.
Oh, yeah. Comfort is good. Yeah.
Yeah.
So,
Comfort and fire.
okay.
Okay.
Uh-huh.
One, two, three.
Mantle.
Cozy.
Oh, I was thinking
Mm.
cozy.
Oh, yeah. Well, it counts. You were thinking it. That was probably on the tip of your tongue.
Yeah, I was like, "Well, it's cozy." This whole
Mm,
time I've been thinking cozy, actually.
cozy.
It's all cozy stuff.
Yeah, so we'll end it there and we'll go
Alright.
ahead and get into our questions.
Mhm.
So, doctor, you've integrated both lifestyle and holistic medicine into your practice, and you've seen some incredible transformations in your patients' health. How has this holistic approach impacted your own journey to achieving joy and fulfillment, especially as yourself being such a high achieving professional?
I very much practice what I preach. This is particularly true with regards to the principles of lifestyle medicine, which I fully integrate into my practice when I give advice to families, whether I am treating an ear infection, whether I'm doing a wellness check, whether I am treating a complex neuroimmune condition. So, just like I advise my families, I also nourish myself with whole plant-based meals that are simple and easy to prepare and affordable. As a physician, I'm busy. My time is limited, but I make the time to nourish myself healthfully, not just for my own health, but also to model it for my patients and also to my family. I prioritize sleep. I don't sleep with my phone. I practice yoga and meditation every week. I spend time outside. I garden during the summer. All of these are principles that I also convey to my patients. In fact, and this extends beyond just, oh, this is what I advise my families. This is something that I take seriously enough that my clinic, my practice sponsors a free weekly yoga class at the local library that I attend weekly. And so in addition to exercise, I also do this weekly yoga. I drink a lot of water. I always tell patients, the water should be the first thing that you put in your body when you wake up and the last thing before you fall asleep. And all of these things should not take more time. Right? Then they should be embedded. We should embed and basically design our ecosystem or surround ourselves to make these choices easy choices, and so that we don't have to put any extra work into healthful eating. Basically, like for example, I tell my families, make the healthy choice the easy choice, like, have fruit at eye level, a child's eye level, and already chopped and already, ready to eat, so that it's an easy choice. Being a high achiever should never ever mean I don't have time for myself. As high achievers, we should never become so busy that we cannot take care of our basic needs like nourishment, sleep, mindfulness, exercise, social connection, and not relying on toxic substances like alcohol to get through our day. Because if we're too busy to take care of ourselves, we're harming ourselves. And no job, no achievement is worth that. And I really think in the United States, we have to stop glamorizing busyness, right? People almost wear it like a badge of honor. I'm so busy, right? I was up all night working, or I worked a double shift, or we just glamorize work and busyness, which is toxic. It's not healthy. And really one of the reasons I left the corporate world and opened up my own practice was because I was too busy to take care of myself, too busy to take care of my family. And now that I have a more joyful mindset, I'm very adamant that I will never be so busy in my practice that I'm going to sacrifice my family, sacrifice my health, and sacrifice my community service. So I've created this life where I embrace the things that not only bring me joy, like good food, like sleep,
Mhm.
like yoga, but are also essential to my health. And I hope that by extension, that also improves my patients' health as I model this lifestyle for them.
Well, that's such a great answer and such a well-rounded, view where you not only care for yourself and practice what you preach,
Mhm,
but you're able to be a model for your patients,
mhm.
which I'm sure every physician ideally would want to
Yes,
serve as a model
yes,
for their patient.
right. Absolutely. Yeah.
Um, So, speaking of other physicians,
Mhm.
you have wellness retreats for women physicians. Tell us more about that. Have you noticed any common patterns in women physicians that are struggling with burnout? And what's a practice that you recommend to help them?
Right. So, I think for me, one of the most heartbreaking symptoms or signs of burnout is compassion fatigue. This is one of the topics that I'm going to cover in the retreat this year. As female physicians, we carry extra burdens that our male colleagues do not. And I'm going to talk about some studies that show some data. And I want to preface that by saying that I have great respect for my male colleagues and I love all my male colleagues. But this is just showing what some of the studies have shown about just some of the differences that in the way the genders practice. So studies show that patients demand more from female physicians. They demand more time, they demand more empathy, they demand more nurturing, more psychosocial support. They send us more messages. This is based on studies that look at portal data. And a recent study from last year, from 2025, sadly showed that patients are more likely to send female physicians more demeaning or negative messages. And similar studies also show that staff demand more from us. They also send us more messages. The same study showed that patients send female physicians 25% more messages than male doctors, and staff send female doctors 24% more messages. So overall, 50% more messages, right? When you count that staff and patients are sending us more portal messages. And staff also expect us to be more nurturing, more kind. They're also less likely, this is again shown in studies, they're less likely to do things to help out female doctors, like, like there's a procedure to be done, getting their gloves and prepping trays, that they automatically do for male doctors. They're also harsher in evaluations. Trainees are also harsher in evaluations to female doctors than male doctors. And staff also accept and tolerate, honestly, sometimes even awful behavior from male doctors. But the moment a female doctor shows some vulnerability, maybe respect, maybe snaps, or maybe responds in a way that shows frustration or is not like 100% nurturing, the staff will complain to admin, whereas they won't do that for male doctors, and they'll tolerate behavior that is completely, really unacceptable. Studies show that female nurses expect status leveling behaviors from female doctors, which they don't expect from male doctors. And those status leveling behaviors take extra time, extra emotional labor. And this is all very interesting because female doctors, we have better clinical outcomes. And it's not because we don't have better clinical outcomes because we have better training, right? And this is shown across all types of fields: primary care, inpatient, surgery. There's a lot of surgical studies out there that female surgeons have better outcomes. It's not because we're better trained. It's we go to the same medical schools, right? We do the same residency programs, or it's not because we're more skilled. It's because we take time to listen. We interrupt patients less. We spend more time with patients. We spend more time answering messages and documenting histories in the EMR. And the system does not reward the way that female physicians practice, even though we have better outcomes. In fact, it punishes us, right? The system is not rewarding or handing out bonuses because you interrupt patients less or because you listen longer, right? In fact, those things are the reasons that female physicians make less money. So all of this takes its toll. And that, all of that information and all that data that I just dumped on you, it is the outcome and the result of that. It manifests as compassion fatigue, which is very scary. I know when I feel compassion fatigue, that's my clue that I need to check myself. That why am I feeling this way? Why am I reacting a certain way when a patient who ultimately is a creature in pain, right? That's coming to us with a request. And sometimes it is a boundary pushing issue, right? I hope this is okay to say the Hippocratic oath is, first do no harm, but then the disclaimer is, but take no shit. Right. So it is important to make a quick assessment when a female doctor or any doctor is feeling uncomfortable or like someone's pushing a boundary, is to ask yourself, is this fair? And that is one very quick way to differentiate between a request that is pushing a boundary and is this pushing a boundary, or is this that I am just feeling depleted or burnt out or compassion fatigue? And if a female doctor is finding themselves, hey, the issue is compassion fatigue, there are individual and practice level and systemic interventions that can be done for this. Now, how much control a physician has over what practice level or system level interventions they can do to make these changes, it depends on where they work, right? Like, for example, I own my own practice, so I am the system. I have 100% control over how I run my practice. So if someone works for the system, they have a little less autonomy. And honestly, I would just tell them, if you're feeling this way, just leave the system and go out on your own. But for some individual level interventions, they include things like mindfulness-based stress reduction, gratitude journaling. There was a study that showed that daily gratitude journaling decreased depression scores in patients significantly. And in patients or in people who were not necessarily diagnosed with clinical depression, they subjectively felt better after gratitude journaling. So, for example, some practice level or system level interventions include leveraging tech and automations. And I talk about that in the retreat. So the retreat's great, right? Because we do yoga, we have whole food plant-based meals, every participant gets a massage. So we do those things, but we also talk about actual solutions to prevent burnout and to prevent compassion fatigue. One of them that I'm a big advocate for is leveraging tech and automations. I'll give the example for myself that I implemented in my practice. Self-scheduling has been a game changer because it has reduced messages from patients like, oh, my child is sick, what do I do? And then now I have a message, right, that's waiting in my inbox while I'm trying to do a million other things. So with self-scheduling, it's been great because if someone is worried about their child, they literally just go to our EMRs and from the patient end is an app on their phone, and they just self-schedule a same day, next day sick appointment, 20 minutes. They fill out a quick form and I see them and take care of it. And that has been huge in reducing the mental load, reducing text messages that, go back and forth. So I feel less stressed because again, I don't have this message waiting for me in the inbox. And the patient is less stressed because they know that if their child is sick, all they have to do is go to their phone at their fingertips and schedule an appointment that day or the next day. And to me, like, leveraging tech and leveraging automations has been key in reducing compassion fatigue, decision fatigue, and burnout. When they schedule an appointment, my EMR also sends them like this acute illness form that they fill out. So I'm prepared for the visit. The visit is streamlined and efficient. And implementing this process has really, really reduced my stress and reduced the number of messages that we get per day when we did our analytics. And I don't worry that someone is going to send me that they're a message that their child is sick and that won't be able to respond in a timely manner because they can just schedule an appointment. In fact, our analytics showed that even though our practice has grown by quite a bit in the last year by about 25%, our daily messages have either stayed the same or actually decreased because we implemented these systems that reduce unnecessary messaging by leveraging tech. So these are the kinds of things that we talk about in the retreat. Like it's not just, oh, let's do yoga, oh, let's do meditation. Oh, that's important, right? And of course we do that, but it's also practical system level solutions that physicians can implement to help with burnout and compassion fatigue. And we will talk about not just compassion fatigue, but building systems that prevent burnout, creating sustainable, joyful practices. And so if anyone is listening and would like to join us, please check out www.dpcwomenscafe.com and the retreat info will be in there. But yeah, it's going to be an incredible experience. It's a nice, beautiful connection weekend with you will be pampered, but you
Mhm.
will also leave with tools and knowledge to actually implement in your practice to prevent burnout, compassion fatigue, and decision fatigue.
Wow, that's great. So, with that being said, let's go ahead into our wrap-up question. So,
Yeah.
who is a model for joy in your life and why?
And I might have said this at the last one. My mom, she passed away in 2023. But the day that she died, it was very unexpected. Like I 2.5 years later, I'm still like, did that really happen? I still can't believe it. She was almost 80, but she was healthy. She lived independently. And so the day that she had a stroke and then succumbed a few days later, but I consider the day that she had her stroke the day she died because she never, even after they turned off all sedation, like she never recovered. But that day she went on a 3-mile walk with her friends. She baked cookies. She worked in her garden. She went out to lunch with her friends. She did all the things that bring her joy, all the things that she loved. She did them that day. And so that's how I want to live my life. That when the end comes, you know what? I spent the day doing the things that I love.
Mhm. Yeah. Well, my sincere condolences for the loss of your mom, but she sounded like a wonderful woman and she prioritized her joy. So what are the top 3 ingredients if you were building a cake of joy, hypothetical cake of joy?
So coffee. I do love coffee and nature. I love being outside. Even when I was a kid, I always used nature to like self-regulate. Like whenever I was like as a kid, like feeling anxious or stressed or whatever, I would just go outside and just sit outside in the backyard. I didn't have the language for it at that time, but I think I was just regulating, just by being outside. So nature, coffee, and family, because family is the most important thing for me.
That's great. So, you mentioned how we can find the retreat. We can mention that again, as well as, is it the www.dpcwomenscafe.com?
Yes, yes. So it
Navigate?
on the top navigation bar, there is one of the options is retreat. And so if you go there, you can find more information on the retreat. It's October 15th through 18th, 2026 in Culver, Indiana. And we're going to get CME. It includes 12 hours of CME also.
Yeah, so definitely for the physicians listening,
Yes.
check out this retreat.
Yeah.
And if you want to learn more about Dr. Adame, we can check out her website as well. And she's on LinkedIn
Mhm.
and she has her practice website for people that are in Culver, Indiana.
Yep.
All right. Thank you so much. It's such a pleasure having you
Oh,
again.
yeah. It's always fun to be here. But
So make sure that all of our listeners who are listening, make sure that you like this episode, leave us a comment, share this episode with a friend, especially a physician friend who may be struggling with burnout or compassion fatigue. Thank you.